Good afternoon. My name is Makinie Fortino, and I am a licensed marriage and family therapist. I am also the founder and CEO of DMHS Deconstructing the Mental Health System, which is an organization that was founded in 2020 on the premise that the mental health system is inherently racist and needs to be modified in order to be more equitable, in order for us to reach people who can't otherwise afford services, predominantly people of color who identify as Black, Indigenous, or people of color. We were incorporated in September of 2020, and in December received our 501c3 status. So all donations are tax deductible. One of the things that we're most proud of in the year of 2022 is that we were able to reach over 200 listings. There are a few things that set us apart from other directories. The first is when you are searching for a person of color, you are going to find a person of color. The second thing is that we not only include individual listings, but we also have a group practice section as well for group practices that are either managed by people of color or have a good number of people of color that are serving. We have a section dedicated to queer, trans, people of color, and LGBTQIA affirming providers and/or providers who identify as that. And we're really happy to say and report that over half of the listings that we have also fell into the queer, trans, people of color, and LGBTQIA plus affirming provider category. Acknowledge that the medical model way of therapy is not the only way that people of color heal. And so we have included a cultural health and wellness section as well. And that section includes professionals who provide services such as yoga, Reiki, meditation, coaching, all kinds of things are included in the cultural health and wellness section. And a big shout out to the organizations that partnered with us to get the word out. We partnered with 4 wonderful organizations that you see in this ad that we put together, and they helped us kind of spread the word a little bit faster, so we were able to get more listings and also get clients to find therapists. Our Organizations We Like page grew as well. So another thing about DMHS is that we really like the idea of we're not going to be the only solution. Our directory, while we do have over 200 listings, is not going to have everybody that people are looking for. And so we also like to highlight the works of other organizations. We also feature other directories as well. So as I said, we're not the only directory out there, and we don't pretend to be either. And so you'll see probably 5 other directories that are really specific to helping various groups. Another thing that we're really excited about is our community resources page. So if you can't find what you're looking for in our directory, and you can't find what you're looking for in the Organizations We Like page, then definitely check out our community resources page. We decided to organize it in the way that it prioritizes Black people, Indigenous people, and people of color first. So the first 50 or so pieces of information that you see, resources that you see, are dedicated just to BIPOC. And then the latter half of the resources page has all kinds of resources, housing, resources for pets, resources for health and dental, all kinds of stuff. And there are over 100 links featured on that page. We also like to advertise different events going on around our community. Some of them are nationwide if they're offered online, like on Zoom, and other ones are more having to do with Washington State if they're in person, usually Seattle or Washington State. We'd like to build on that, and so if you know any organizations that do community events, especially free community events, and especially for people who may not otherwise be able to afford resources, definitely get in touch with us. We want to help advertise that. We also have a section called free and low cost CEUs and trainings. And so in order for people to maintain their license to provide mental health services, they have to take a certain number of continuing education credits. So we go and we kind of search for what free trainings are out there, especially ones that offer free CEs to people, as a means to, again, build equity and help therapists afford to maintain their license status. One of the things that we are most proud of is that we launched a free therapy program this year, just a couple of months ago. I think it was August or so. This program is really cool. It's all volunteer right now. All the people that you see listed here are the current providers. We also have 2 approved supervisors, so myself and Dr. Kimberly, for people who are therapists, who are associate therapists, who are seeking supervision. So their original intention was to not just provide services to people who couldn't otherwise afford it, but to also make sure that our volunteers felt like they were getting something out of it as well. So our very first volunteer, Sierra, is an associate therapist with 253 Therapy. So we partnered with 253 Therapy and we said, hey, let's get Sierra a few more hours of supervision and in exchange have her take on 2 or 3 clients. And it just kind of grew from there. And we ended up having therapists sign up for helping to volunteer who don't need supervision, who really just want to give back. And so what each of us do is we offer a minimum of 12 sessions to clients. And we really feel like 12 sessions is just the beginning, but a really good starting point for clients, so that they don't feel like they're doing a revolving door of applying for services. They got the 12 sessions for up to 12 months. And then from there, we get them connected to long-term community resources. But while we're providing therapy, we're also kind of connecting with these community resources. Many of us are well connected in our communities. And then we help clients kind of embed themselves into the community so that they have a support system that they can really rely on in addition to receiving services from us. So what is the financial impact? So what we found between 2021 and 2022, and this is an average, assuming that therapists who are listing themselves on the directory aren't listing anywhere else, we're saving an average of $64,000 for our clinicians who are listing themselves here at DMHS for free on our directory. We're giving free advertising to the organizations that we list in the organizations we like page, as well as our Get Help and Resources page. We don't have an estimate of how much in advertising we're potentially saving, but it is another location for them to advertise themselves for free. And with regards to our free therapy program, we did a calculation of an average. And so for the clients who are currently with us right now, who are receiving 12 sessions for up to 12 months, they're saving approximately $1,500 per client for the 12 sessions. Again, on average, because therapy costs anywhere from $80 to $200. These are things that people who have either collaborated with us or found out about our organization are saying and giving feedback to us. They're saying things like, oh my goodness, this is amazing. What an awesome directory. Thank you so much. It's really nice to get feedback like this. We kind of like to use the feedback and build on it. And this is what our clients are saying about our free therapy program services right now. They're saying, awesome, thank you so much. Really appreciate this. You have no idea how much this will help me. We are targeting clients who either can't afford therapy or have received the runaround when they've requested therapy services and or don't have insurance. And so it's really nice to get feedback like this. And it's really good for us to give back. It feels really good. So how can you get involved? So approved supervisors in Washington State, we would love to hear from you if you're interested in donating a couple hours a week to our associate therapists for additional supervision hours while they provide free therapy services in our program. Associate level therapists and or agency affiliated therapists who are open to volunteering a couple to 4 hours a week. We'd love to get you on board as one of our volunteers. And fully licensed therapists anywhere in the United States, we would love to hear from you if you'd like to volunteer your time. Thank you so much to everybody who has donated. It goes a long way. It really helps us in maintaining the web page and keeping these services free. And these are ways that you can help if you're in the community. Please Tell people about our organization, share our directory with potential clients, people who say they've been looking for a therapist for a long time or they can't find therapists who are available. We have a lot of therapists who are available in our directory. Again, over 200 therapists have listed themselves. And that's not counting the group practices. Each group practice has an average of 5 to 10 therapists within their group. Please consider donating to us. We have the scan code right here on this slide for your convenience, and a link as well if you'd like to donate. And if you have a Get Help or resources page, we would love to be on it, because the more visibility we get, the closer we are to helping clients find therapists who can relate to them culturally and ethnically, even faster than usual. So please, that is the way that you can help us. Let me go ahead and stop. I just want to say thank you so much again to people who have donated, to people who have listed us on their Get Help and Resources page so they can help potential clients reach therapists. Thank you so much to our therapists who have volunteered to give your time to clients who really need it. And thank you so much to the community for continuing to support and connect with us. If you haven't yet, please reach out. We respond relatively quickly. Thank you so much again. This is our annual update for 2021, 2022, and I will see you next year.